Okay, so we have just worked out some of the tech issues here, and I want to thank Autism Connect for having me and for helping me with my tech issues because it's not my strongest point. And I've had the pleasure of doing some podcasts for the Akil Foundation, and they've been wonderful as well. So I think we're all set up. We're going to talk about methylation today. So if you guys are on and ready, you might want to share it with friends. This is going to be a really interesting topic if you haven't heard about methylation before, and then if you have, I'm hoping that the way that I'm going to present the information is very like usable or consumable. My goal is to help kids, and we need to look at their medical concerns and have them, assessed and addressed. So, first off, for those of you who don't know me, I'm Dr. Sonya Doherty. I'm a naturopathic doctor, and I focus on the biomedical treatment of neurodevelopmental concerns, primarily autism, but certainly other concerns that fall within that realm as well. And today I just wanted to thank Autism Connect because, as you may know, their goal is to help the millions of parents, who have kids diagnosed with autism who are looking for resources. Autism Connect hopes to empower and bring information to parents so that they can find the best choices and treatments for their kids. So thank you very much for making this happen today. And I think maybe we'll just dive in. So the first thing I think we always need to talk about when we're talking about autism is presumed competence. So when we look at this concept of, presumed competence, it's a really important starting point. So people talk about acceptance and we talk about things like neurodiversity, and those are important concepts. But one that I encourage you to sort of think about is this idea of presumed competence. So presumed competence is this: whenever we are dealing with our children or working with children, we have two choices. We presume that they're competent, and so we treat them like we would any other child that age or person of that age, and that's presumed competence. You may not have the indicators through verbal communication or pointing or even responsiveness with eye contact. You may not have indicators that that person understands you, but I've been working with people diagnosed with autism for 18 years. I have my own son with autism, and I can tell you that children with autism understand way, 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 way more than you think they do. Some of you may know that, and that's wonderful. If you don't, please start to have that concept really sink in. Your child understands way more than you think they do, and often they understand everything. So by presuming competence, we protect our relationship with our children, we honor them, and when we proceed forth with treatment, then we do it with respect, with the idea of improving quality of life and opening up developmental opportunities. When we don't presume competence, when we just assume someone isn't smart or they don't understand, that can create harm, and that harms the person that we are working with or our children, and it harms our relationship with them. So I always think that's a really important starting point when we're talking about treatment, because one of the questions and criticisms that I'll get, and I completely understand where it's coming from, is how can you talk about presumed competence and neurodiversity and acceptance and then talk about treatment of autism? Like, how do those things go together? And the reality is that people diagnosed with autism, just like other concerns, like things like ADHD or someone who was born with Down syndrome, whether it's a genetic reason or an environmental reason, there are differences in the bodies of people diagnosed with autism. They have lifelong inflammation in their brain. They have more sleep issues, as many parents can attest to. I think we didn't sleep for years and years and years. But they have more digestive issues. They have increased risk of things like allergies and autoimmunity. So we know that children diagnosed with autism have more medical concerns, and so they need more medical assessments. And that's really, for me, about, from a human rights perspective, we are going to accept that our children have autism, but we're also, in accepting that, we know that they have more medical concerns. So they need treatment for those. So if your child is constipated or has diarrhea and the doctor says, well, that's just autism. No, it's not. Your child's not sleeping, that's just autism. No, it's not. So one of the really big reasons that children with autism have these problems is they have impaired methylation. So what is methylation? Methylation is how two cells from mom and dad become a human baby. So it is the process of development, making neurons and cell membranes and basically building the human being from two, original cells from mom and dad. The methylation cycle also repairs damage. So this is where it becomes really critical for people with autism, because people with autism have higher levels of toxicity. So we know that there's higher levels of lead and mercury and pesticides and phthalates and other environmental pollutants. We also know that people with autism have impaired detoxification of these toxicants, which we'll touch on as it relates to the methylation cycle. So the critical thing to sort of look at here is that methylation governs development. In the first 2 years of life, methylation is doing all the heavy lifting as it relates to brain development and repair. So a person who has impaired methylation, they're not going to be able to fix the damage that comes from environmental pollutants. And, for those of you who are in North America, the Red Cross here did a study, and this is probably almost a decade ago. They found that the average human baby, the average baby in North America was born with 700 chemicals in the cord blood. So that's just starting off their life, not to mention all of the environmental pollutants that they then would be exposed to through food and air pollution, all of the environmental pollutants that comes from all the industries. So when we look at methylation I describe always as two cycles, like a pink and a green wheel, right? So if we sort of focus on the pink wheel first, the pink wheel governs the folate cycle. And the other way to sort of look at these wheels is like a bicycle. So we've got methylation, we want to move forward with development, and we've got these two wheels that are really, really, really critical. So the first wheel, which I'll call the pink wheel, is the folate cycle. And the folate cycle takes folic acid from our diet and it converts it into active form. So folate is like gold for the brain. So if you don't have enough folate, you're going to have problems making the methylation cycle work. And one of the most important interventions as it relates to diet is directly related to the methylation cycle. So the folic acid cycle takes active folates and converts them into, it takes folic acid from the diet and converts it into active folates. The problem with some of our sort of national decisions around the world is that they've decided to fortify our grains with synthetic folic acid. So synthetic folic acid has to be sort of transferred into active folates through a number of different steps. People who have autism have impaired metabolism of folic acid. They have trouble making synthetic folic acid into active folates. So they will slow the methylation cycle. They will slow that bicycle of development, right? So we want that bicycle moving forward. Just imagine your child is moving at a similar speed as another child, then the folate cycle slows down, the bike slows down, they slow down. Sometimes we see regression, sometimes we see a plateau in skills, but this folic acid cycle cannot run properly when children are constantly getting synthetic folic acid through the diet. And so the synthetic folic acid is fortified into the grains in many, many, many countries. I can't speak to all the countries, but certainly, when we were in China, some provinces in China, all of Canada, all of the United States, they put synthetic folic acid into the grains, and the average North American child will have about 5,000 micrograms of synthetic folic acid in their diet. So just to give you a comparison, when women are pregnant, they're recommended to take 400 micrograms or 0.4 milligrams. So 5,000 micrograms or 5 milligrams of synthetic folic acid is a lot. And it's particularly, damaging to someone who can't take the synthetic folic acid and then convert it. the other thing that's important to understand about our folate receptors, and just imagine that folate equals development. Methylation equals development. Folate equals repair. Methylation equals repair. So when we look at the synthetic folic acid, it also is preferentially bound to the folate receptors. So inside your child's brain, they have receptors that are kind of like a puzzle piece. And so the synthetic folic acid in the diet will bind there first. So one of the big questions that I'll get is, what do you recommend from a dietary perspective? And well, I recommend taking out the grains because they are fortified with synthetic folic acid. There's a number of other reasons, and I might get into them in a bit, but the number one reason as it relates to methylation, well, one of the most important reasons as it relates to methylation is the synthetic folic acid. So if it preferentially binds, then even eating green leafy vegetables or lentils on top of that is not going to be as helpful as taking it out. And so some of the patients and the families that we work with will come in and they'll say, oh, we've been diagnosed with MTHFR. We have MTHFR polymorphisms. We have a gene that doesn't convert folic acid very well. And this has been linked to autism. So they'll say, well, what can we do? Can we take methylfolate? Can we take B2? Can we take B12? What will help? And B2 and folate and B12 will help because those all help the bicycle move forward. But if you don't pull out the synthetic folic acid, then you can't really get access to those folate receptors. And so one of the reasons I always say yes to opportunities like this, that I was asked by Autism Connect and the Akil Foundation to jump on and sort of talk to you guys today, is the best thing you can possibly do for your child, in my opinion, is to remove the complex carbohydrates. The things like rice, bread, cookies, cereal, pasta, right? And immediately the feedback I'll get is, oh, well, as a family, rice is a staple, or pasta is a staple, or my child loves bread, or I can't get them to eat anything but cookies. You have to understand that the folate cycle, when it's not working, puts the brain into panic mode. And when the brain is in panic mode, all kids are going to want is carbohydrates. So this panic mode is called immunoexcitotoxicity. It's happening because the immune system in the brain is overloaded. So we sort of think about the brain typically, and we think about neurons. Neurons make up 15% of the brain. So neurons are like long cords, like your telephone cord. They send messages along a cord. Methylation also makes the cords, and it makes the myelin sheaths that surround the cords. So methylation is involved in neurotransmission or brain function in every single way. But most of the brain, 85% of the brain, is actually an immune system. And this immune system broadcasts information, just like your phone, like your Wi-Fi, right? It's broadcasting the information. And that relies on methylation. That also gets really stressed out when methylation is not working properly. So the immune system in the brain turns on. So immune system, immuno, excited. And it's excited to the point of being toxic. So if you want to know why your child hurts themselves or why they hurt other people, why they stim, why they can't sleep, why they drone, like they make all these sounds, they rock, they spin, it's because their brain is in a state of immunoexcitotoxicity. And that is because the methylation cycle is not functioning. So when it comes to diet, when I say to people, please consider taking the grains out of the diet, and they say, well, we eat rice as a family, or we eat pasta as a family, or my child loves cereal or cookies, or they won't eat anything else. This is a medical intervention. And when your child's brain is hurting all the time, those foods are hurting them. It's not helping them. And they have no control over it. Grains are also about 8 times as addictive as cocaine. So when you're asking a person who's like 6 years old, whose brain is hurting, their gut might be hurting, they're not sleeping, you're asking them to change their diet without your help, they're not going to make that choice. So I know for us, and I didn't say this, I should have sort of introduced, I think I did, maybe I did. I have a son with autism, and when he regressed, we put him on the diet, very strict diet, and he would only really, eat lentils, and lentils are okay on the diet, but you can't really just eat lentils if you want to be successful in getting folate and the methylation cycle working, right? You need lots of vegetables of different types. You need lots of protein. You need, whether it's meat or nuts or eggs or seeds, you need to have enough support for the methylation cycle to make the brain chemicals. So when the bicycle's moving, this methylation cycle actually makes 200 other cycles in the body work. So one of these cycles is the production of serotonin and dopamine. So as soon as our son regressed, we put him on the diet. He's only really eating lentils. A very dear friend of ours sort of said, like, you guys were the ones always telling other people to do the diet really strict, and with some really compassionate, gentle nudging. We put him, strictly on the paleo or modified ketogenic diet or specific carbohydrate diet or GAPS diet. They're all the same in terms of the core benefits come from removing the complex carbohydrates and the dairy. And I will touch on the dairy piece as I move on to the other wheel of the bicycle. But when my son one day he found a chocolate almond that, I guess one of our kids was eating, and it fell into the couch, and he found it and he ate it, and it was like he was on drugs. Like, he found it, he ate it, his brain kind of went berserk, he got super, super hyper, and then he spent, the better part of the next hour looking through the couch frantically to try to get more sugar. So our kids also, because of the sensitivity in the brain, or maybe it's the inflammation, they're really prone to becoming addicted to these foods. And so early on in my career as a naturopath treating autism, I realized that I don't think kids have, certainly they have feeding issues, they're picky, they have sensory issues, but I think overreaching all of that is they're addicted to the carbohydrates. Because of the brain inflammation, or because of the immune system in the brain changing, they have become completely addicted to carbohydrates. And so the only way that you sometimes can find success in dietary intervention is to take it away. So that really, the folate wheel is, for me, pretty much about the diet. To further help the folate wheel, you can provide methyl tetrahydrofolate. That's an active form of folate. You can provide folinic acid, which is an active folate. Those have both been shown to be very helpful for children developmentally. One thing to sort of touch on here is, if you've tried supplements for your child and your child has got worse, there's a reason for that. When the methylation cycle slows, it slows down all kinds of different things in the body. So the brain, to broadcast information, requires energy. When the methylation cycle is not working, the energy goes down, the stress goes up. Well, the same thing happens in the digestive tract. The digestive tract, or the motility in the digestive tract, completely slows down. So I would say the majority of the kids that I work with in the very beginning have stool accumulation along the digestive tract, and the digestive tract is, 8 to 15 feet long, depending on the age of your child's, and all along that can be old debris, old stool that actually sticks to the gut wall. And so if you put your child on supplements, you've heard, oh, methylation is a problem, I'm going to start methyl B12, I'm going to start methyl tetrahydrofolate, I'm going to try dimethylglycine. If your child gets worse, they have something going on in their gut. So don't despair. Don't say, oh, this supplement doesn't work for my child. Go get the gut looked at. Take a look at diet. Clean out the debris or the garbage that accumulates within the gut, and then you can go back to those treatments. And I had a very recent case where this happened, where the parents had tried all kinds of different methylation supports. The child had reacted poorly to all of them in terms of becoming more aggressive, self-injurious, having sleep problems. If you have a child who responds poorly to methylation, remember that methylation governs the motility in the gut as well as the way the brain functions. So the methylation cycle, when it's not working, the other way I describe it is your body goes into chaos land, right? So chaos land is not sleeping, your brain hurting, stimming, head banging, toe walking, flapping of hands, lining things up, being fixated, having, sleep problems, can't get to sleep, can't stay asleep, running back and forth, pacing up and down. All of these are when the brain is in this chaos land. So to get your child out of chaos land and bring your child into what we call the promised land, the way the body is functioning at its optimal, you have to take the complex carbohydrates out, the grains out. You need to really take the dairy out, and then a child can start producing more brain chemicals that are more helpful. Because if the brain doesn't have enough things like serotonin, dopamine, norepinephrine, GABA, then what will take over is glutamate. And glutamate is a very important neurotransmitter. It's a very important brain chemical, but it's excitable. So you ask the brain to process something. With glutamate in charge, that processing will result in an action or something that excites the brain. This is a lot of the reason why our kids are noise sensitive, right? They can't stand certain tastes or textures. They're sensory seeking, they're sensory avoiding. If you put an excitable brain chemical in charge of the brain, you're not going to be able to process sensory information very well. And sensory information in the brain, if it is not processing well, then negatively impacts motor planning. And motor planning, deserves its own whole webinar, but the motor planning is what allows our children to track moving information with their eyes. So visual processing, to communicate or articulate, so expressive communication, and have control over their body. So a lot of what we do in biomedical treatment is to reduce the excitement in the brain, to allow the brain to process sensory information, help the brain produce more energy, more neurotransmitters, and get integration so that the motor planning becomes smoother and smoother. And a lot of people with autism will tell us, whether they're communicating verbally or through a letterboard or typing, that they have a lot of difficulty controlling their body. One boy I worked with years ago communicated off a letterboard, and he said through the letterboard, "I don't even know how you're moving your mouth." So interestingly enough, as we're treating, younger kids, when their visual processing and their brain calms down, their visual processing improves and their brain calms down, they'll actually start looking at their parents' mouths to figure out how they're moving them. All this is movement. All this takes energy. The gut takes energy to move. So that's sort of the folate cycle with a bunch of different information in around it. The other part of the methylation cycle is called the transmethylation cycle. I typically, in my brain, I represent this as a green wheel. It's the other wheel of the bicycle. So you need both wheels of the bicycle moving forward for kids to improve developmentally. And keep in mind that all regression or all loss of skills is medical. All speech delay in autism is medical. The human beings were designed to speak. And I know that some of the older children and adults will not progress on to expressive speech, but the brain is designed to be able to speak. And so if you've had a child who suffered a regression, it's really important to understand that the methylation cycle is involved in that. So all regression is medical. So to get this transmethylation wheel working optimally, or to, turn the transmethylation wheel, typically I recommend B12. B12 is the most effective way to turn that wheel. I do find B12 injections are the most effective. I think a lot of autism doctors would agree with me. The injections are done with a really small syringe. I think I actually have one here. I don't know if you can see, but it's very small. It's an insulin syringe, and those are injected by parents into the buttocks 3 times a week. And this has been shown to improve language, expressive language, and receptive language, verbal communication and nonverbal communication, social interaction. And I would say fine and gross motor skills, because you're literally producing energy within the body. So methyl B12 can be given orally. It's very safe, but the absorption's not great, so it's only 5% absorbed. The injection itself is 100% absorbed. And so by injecting it into the subcutaneous space of the buttocks, you're injecting it into the white fat. And the white fat then stores the B12, slowly distributes it out into the bloodstream over the course of 12 to 36 hours. There was a great study by Richard Deeth, who's a neuropharmacologist, and he found, when he examined not to be gruesome, but the brain tissue of people diagnosed with autism who had passed away, they found very low levels of B12 in the brain. So the brain is 2.5 pounds of fat. B12 is a water-soluble vitamin. When you take it in an oral form, you're going to urinate out the extra, but it also doesn't stick around, right? Fat-soluble vitamins store, water-soluble vitamins are removed fairly quickly. So to compensate for that in a B12 deficient population, which also includes people who have schizophrenia and dementia, Alzheimer's, then we need to store the B12 into the fat so that it can slowly distribute out into the bloodstream and be constantly available. The methylation cycle, transmethylation, so the green wheel, can also improve with things like DMG. So keep in mind, this is the methylation cycle. It takes methyl donors, and through these 2 cycles that spin together in a coordinated way, you're going to deliver methyl donors to 200 other cycles. So this is like, the methylation factory producing the products. The products are put on trucks and they go all throughout the body. So methylation is essential to development. Research down at the Arkansas Children's Research Institute shows that 90% of children have a problem with this transmethylation wheel. So 90% of kids have methylation impairment when they have autism. And that's why so many of them do so well with methylation treatment. Methylation requires methyl donors, so things like trimethylglycine, TMG, dimethylglycine, DMG, methionine, SAMe, acidinomethionine. These all help the folate cycle. So does zinc, so does choline. Choline can be through a supplement, it can be through eggs. But the dietary issues in kids with autism, the digestive issues in kids with autism, set them up for a vicious cycle of medical concerns that they will not get out of unless it's treated. It's like if someone had a migraine their whole entire life, right? Neurodiversity does not mean that we accept that people have migraines and don't treat them medically. So yes, we accept the autism, but we also understand that with autism comes methylation issues. And by treating the methylation issues, we not only improve quality of life, we improve developmental potential. So, methylation is essential for sleep. Just like a very simple but very important intervention. How many kids with autism don't sleep? Most of them, right? So methylation makes serotonin. Serotonin then makes melatonin to govern sleep. So if your child with autism isn't sleeping, they probably are melatonin deficient. So we would then supply melatonin. One of the questions we'll get from parents is, will they become dependent on it? They're not making it anyway. So this is like if I had a job and I'm dependent on the money to pay my bills, and then I lost my job, and you say, well, you were dependent on your job. Yes, I was, because I need something that I can't create myself. That may not be the best analogy, but I think you know what I mean. So you can't become dependent on something you're not making. But through treating the methylation cycle over months and years, you'll repair a child's ability to make their own melatonin. Melatonin protects the brain. Keep in mind that in recent years we've discovered that there is a lymphatic system in the brain. The lymphatic system in the brain actually only really works at night, and it's called the glymphatic, which I always kind of funny. But the glymphatic system reduces the inflammation and cleans out toxins at night. And so when children aren't sleeping, particularly in their age design window, right? So when we want kids sleeping as much as they can before midnight. Every hour before midnight is worth 2 for brain development. So sometimes kids will go to sleep at 11 and then they sleep maybe later, but those hours are not as good as the hours, say for a 5-year-old. They should be going to sleep at 7 to 8 p.m. And again, sometimes we get the feedback, well, our family stays up late, or we all go to sleep in the same area or the same room, we co-sleep. Their dad or their mom doesn't come home till a certain hour. I encourage you to think of these interventions as medical. They're not lifestyle. This is not, hey, clean up your diet, improve your nutrient status, and those things are important, but these are medical interventions that change the course of autism. Or in Martha Herbert's book, which I highly recommend, is The Autism Revolution. So my daughter's here now. So, the Autism Revolution is a wonderful book. It talks about the medical interventions that can change a person's life with autism, and that book is focused on diet. So, I don't even like sort of saying diet, because diet gives you this illusion of like weight loss and wellness, and those are important things, don't get me wrong. But from a medical standpoint, this is more like diabetes. Children with autism cannot process and deal with the grains. They cannot process and deal with the dairy, and they are extremely B12 deficient because the methylation cycle is impaired. The methylation cycle also makes something called glutathione. Glutathione you may have heard of. Glutathione is the most important antioxidant in the body. It's actually called the master antioxidant. And it's responsible for detoxifying things like lead, mercury, aluminum, pesticides, fire retardants. I'm going to sit here for hours if I go through all the chemicals. In autism, 80% of the glutathione has been shown to be deficient. And this is really important as it relates to the repair piece. So if you're exposed to toxins, as we all are, you deplete the glutathione. And once the glutathione is at a very low level, that brain goes into the panic mode, right? So the immunoexcitotoxicity. This is because of the glutathione deficiency, because of the oxidative stress, because of the brain inflammation. And methylation is really important to reduce and govern all of those. So some people will ask us, well, should we give glutathione? In certain cases, sure. But the glutathione is actually made up of glutamate, glycine, and N-acetylcysteine. So it's made up of three things. Glutamate, as I talked about before, is part of the problem with an excitable brain. So the best thing to look at is actually giving N-acetylcysteine. And this was studied at Stanford in a randomized controlled trial with young children. And they gave N-acetylcysteine, or what some people call NAC, to children diagnosed with autism. And what it does is it basically mops up the glutamate, because it takes the glutamate with the NAC and the glycine and it makes glutathione in the brain. It's such an elegant, beautiful way that the brain governs itself. And B12 facilitates that. In research, B12 has been shown to improve glutathione. And you're going to see improvements in communication, whether it's verbal or nonverbal. You're going to be seeing improvements in fine motor, including things like pointing. Keep in mind that pointing is a motor plan, right? For me to point, right, and then look back, and that's a motor plan. It actually takes a lot of energy. So one of the things that happens when parents will say, well, sorry, I'm remembering that you guys might have questions, and I want to make sure I account for them. So when I lost my train of thought there. Darn it, well, where was I going with that, Elle? The train just goes sometimes. Okay, well, it'll come back probably. I'll pause here and I'll just take a look at your comments. This is my first live stream. I'm sure that's apparent. That's quite apparent. But so it looks like Marissa's cut the carbs out, which is amazing. Okay, maybe my thing was all about glutathione. Okay, the name of the book is called The Autism Revolution. Okay, so that's okay. So it looks like I got most of those. The other thing that I want to touch on with the methylation cycle, because I know we sort of have the 30 to 45 minute time frame, is the mitochondrial function. So in the research in autism, what they found is that mitochondrial function is impaired. So mitochondria are in all of our cells, and mitochondria make all the energy in our body. So everything we do requires energy, just like, pretty much everything we do requires money. So mitochondria produce the currency or the energy in the body. It's called ATP. And your child, if they have speech delay, they have mitochondrial issues. If they had regressed, that's a mitochondrial problem. Something has damaged the mitochondria. Mitochondria are uniquely sensitive to toxicity, and they're protected by glutathione. So again, this is where we get into the importance of the methylation cycle. People who have children with autism typically themselves have methylation impairments. So that research down at the Arkansas Children's Research Institute showed not only do 90% of children with autism have methylation issues, but so do their parents and in fact their grandparents. And toxicity will impair methylation. Things like yeast impair methylation in many different ways, things like Clostridia. Some of you may have kids where you think they might have pandas or PANS or PATANs or like chronic infection. All that's going to slow methylation. So developmental delay, period, even if we step outside just discussing autism with things like global developmental delay, ADHD, cerebral palsy, Down syndrome, all of these will result in methylation impairment. Methylation support will improve mitochondrial function. You're getting more ATP, you're getting more energy. This is going to result in improved development, whether it's fine motor skills with strength, the ability to, be more involved in self-care, dressing, whether it's holding a pencil or a pen, whether it's translating hopefully into enough strength for the muscles. And keep in mind how many muscles it's taking for me to talk. It's totally unconscious for me, right? My muscles organize themselves and fire. I don't have to think about it. My sensory system isn't stopping my motor planning. But in autism, the sensory system is stopping the motor planning. Some of you may find, your child speaks more on their own, right? You ask them something, they don't respond, but they're off in the corner. You can hear them talking. Or when my son was little, he used to, he was 4 or 5 and he would be like, blah, 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 blah. We knew he was talking, but we couldn't understand a darn thing. That's all mitochondrial. Articulation, clarity, that's all mitochondrial. So by improving methylation, you're improving so many different things, and I can't even really touch on them all today. Another really critical one is the production of carnitine. And carnitine shuttles essential fats into the cells. Carnitine is one of the best studied supplements in autism, and it helps to improve social interaction, social skills, cognitive performance or academic performance, and expressive communication, because it allows fat into the cell so that the mitochondria can make energy. And so that's why a lot of us use things like high dose fish oil. We may use carnitine. And again, remember what I said about supplements. If a supplement causes an aggravation, your child has garbage or mucus or sticky junk stuck in the gut. And those of you who may know me or have worked with me, you have to flush the gut and clean the gut comprehensively in order to really benefit from these supplements. Even more so with each generation that goes on, actually. I'm 18 years in, so 18 years ago it was a lot easier to get kids better. And in fact, when I was training in the US, they actually would call the kids in Canada, they call them autism light, which I didn't like. I didn't like hearing that because I had a child with autism. But the point they were making is that the children in Canada were a lot easier to treat. The American exposure to toxicity is different than Canada, but we've now caught up, unfortunately. It's not really something we should be bragging about. We are, each generation, having more toxicity. We also have the epigenetic damage of my genes were exposed to lead, they were damaged, then I passed damaged genes on. And so the research into methylation and epigenetics shows that even if my great-grandmother smoked or she lived near a coal mine and was exposed to mercury, those damaged genes are passed on. So with each generation, it's harder to get kids better. And so they're aggravating more from supplements. And I feel so lucky to have had the opportunity to work with literally probably 10,000 families with autism. And you have to clean out the gut. Like, this is the problem with supplement reactions. And my practice, someone will come, they'll say, oh, I've seen all these doctors, I've tried all these things, and nothing's working, or everything's making my child worse. Your child has junk in their gut. See if you can get a bowel x-ray, see if you can shift the diet, get some help, right? Get the stuff out of the gut. You could use things like probiotics and enzymes, but I find more and more kids are aggravating from everything. So I'm talking to you about these interventions. Say you go and you get B12 injections, your kid goes berserk. It's about the gut. So this is a really important message for you guys to have and to share with other people. When you're in these groups with other parents and they're talking about, well, my child tried this and they did awesome. Now you try it, your child aggravates. No, it's the gut. Know that that supplement may help. It just has to be a next step, or vice versa, right? If you've had a supplement that's really helped you and you're recommending it, and a friend of yours is like, well, my child, that was a disaster. It's the gut. It's like having your kitchen full of garbage bags, or using every single pot and pan and dish in your kitchen. That's what's in the gut. It makes it so the gut can't function. You flush it out. You allow the gut to start healing. It takes about a year or two for the gut to heal in young people. Older people, it's more. But with time, the gut will heal. And then pretty much every supplement under the sun has the potential to work. But the methylation, diet first, methyl B12, trimethylglycine, dimethylglycine, methyl donors, and just keep in mind that the odds are if your child is on the spectrum, they likely have methylation issues. And there's a great doctor, his name is Dr. Sears. He has a book called The Autism Book. think it's page 256, at least in the edition that I have. And he says there, what I tell every family that I get to work with, or every family I get to talk to like this, I think that every person who has a child with autism, every parent who has a child with autism should consider methyl B12 injections because of the significant improvement that you can see in their communication and their social interaction. And so that's really the things that I wanted to touch on today. I don't see too many questions here. I'm just going to check in with my Autism Connect colleague here. Anything else we should cover? And then I think we'll sort of end on this session and thank everyone who has been part of it. And I think once I end this, then I believe they'll be able to share it, but that again gets back into my tech issues. So if you guys don't have any questions, then I am going to thank you for joining, and I will say have a great night or a great day, depending on where you are, and all the best to you and your family.